Good afternoon, Kevin. How are you today?
Good, Danielle. How are you?
I'm doing well. We have
Good.
another episode of our podcast coming up today, and the topic that you wanted to touch on today is gastric health. So if you want to just take it away, we can get started.
Sure. So basically, what we're going to do is we're going to exclude any of the lower GI tracts, such as the large intestine, the small intestine, the
Right.
duodenum, that type of thing.
Okay.
We might mention them periodically, but I want to focus on the stomach itself because of its primary importance to our health overall. And I think that's
Absolutely.
important. It's often overlooked.
I
Uh,
think you're right. Yep.
there are a few medications that are being given to basically influence gastric health, they could elaborate negativity, and that's what I want to touch on. So, such as proton pump inhibitors,
Okay.
which are medications that are directed at shutting down the output of certain cells, and we'll touch on that.
Mm-hmm.
I'll just be
I,
brief with this. So
yeah.
basically, the stomach in general, I want to fulfill the dialogue here so people understand that anatomically the stomach is lined with epithelial cells called parietal cells. And these parietal cells are responsible for secreting two primary things. And then one is hydrochloric acid, and the other is a protein called intrinsic factor. And many of us have heard of intrinsic factor because it's vitally important for the absorption of B12 or methylcobalamin.
Oh.
Now, what's important here is to understand what is the function of parietal cells in the excretion of hydrochloric acid and why hydrochloric acid is so imperative as far as its necessary component directive in health. Um, Hydrochloric acid is, as the name suggests, is an acid. And the correct environment of our stomach pH wise, and I think many of us know what pH means, it basically symbolizes parts per hydrogen or
Mm-hmm.
the hydrogen ion,
Mm-hmm.
and it signifies a base or an acid. So anything generally 7.0 is considered stable or equal as far as complete equilibrium and base and acid. Anything above 7 is generally base or alkaline. Anything below 7 is generally referred to as acidic. And so that is our definition. Now, the stomach environment is meant to be acidic. It's meant to be at a pH of about 1 to 3. So that's very acidic on that scale. So let's remember
Mm.
7 as being basically
Neutral.
exactly
Okay.
from base to acid. So
So very
main,
acidic. Yeah.
yeah, for maintaining this acidic environment is extremely important. And a lot of people misunderstand that an acidic environment of the stomach leads to ulcerations, gastric
Right.
and duodenal peptic
Yes.
ulcerations.
Ulcers are
But
not
in
from an acidic stomach, no.
but indeed, it's not high stomach that creates ulcers. It's the
Mm-hmm.
infiltration of a bacteria generally called H. pylori.
Mm-hmm.
And H. pylori, that's short for H. Helicobacter pylori, is
Mm-hmm.
basically the bacteria that infiltrates and begins to gnaw, particularly in the upper GI, duodenal is an example, and gastric, and begins to erode the lining of the stomach. And that's the primary cause of ulcerations. Ulcerations, now here's what's interesting about, I'm just going to call it pylori so everyone understands, and we're
Yes.
going to keep it short.
Yeah.
Pylori exists in an environment that is higher than the stomach's pH average. Pylori, the bacterium, is generally found to be in a favorable source at 3.5 to anything as high as 6, or maybe even higher. So
Oh.
by keeping the stomach in an acid environment at a correct
Mm-hmm.
pH of 1 to 3,
Mm-hmm.
we're able to avoid infiltration in many cases of the bacteria.
Oh, that's interesting.
Now
Okay.
the bacteria
And
is
where
a
does the
class.
bacteria, where does it come from? Is it,
The bacteria can be given air. It can be given mouth to mouth.
okay.
It can be given through certain food contaminations and things like that.
Okay.
But it's important to understand the bacteria is a class 1 carcinogen.
Oh,
This is
wow.
really important to understand.
So then it's not like one of those things where it exists in your body and it becomes out of balance. Like it's
Correct.
introduced externally into the
Correct.
body, an excipient.
Even
Okay.
though, correct. Even though some situations have found microscopic amounts of the bacteria, and it seems to be controlled due to the stomach's correct environment of a pH that's lower than
Sure.
3.
Sure.
So
Okay.
that's important to understand why it is important to understand the correct activity, the correct environment of the stomach,
Absolutely.
not only for protecting us from a pathology like pylori,
Yeah.
but also maintaining an intrinsic factor, which is important for uh, B12 absorption.
Uh-huh.
Now, if we lose B12 absorption, we undergo something called megablastic anemia, and in some cases it can be macrocytic anemia. And that anemia can be associated with low amounts of this intrinsic factor.
Mm.
So now we understand the trail that leads us to why it's so important to maintain a healthy stomach
Uh-huh.
rather than focusing on, which is important at times, IBS, irritable bowel syndrome,
Mm-hmm.
Crohn's, celiac, that type of thing.
Right.
Because a lot of those originate from a disproportionate environment of the stomach. If the
Well,
stomach is not setting up for the environment, it
mm-hmm.
becomes acid, alkaline, because as food transitions through the alimentary tract, we deal with a more alkaline scenario as it's traveling through the small intestine to the
Mm-hmm.
large intestine.
Mm-hmm.
So, well, what's important to understand to set up the environment, that's primarily done by the governor, which is the stomach and the environment of the stomach. And once that is put into place, then basically everything else down the alimentary tract is addressed correctly. Everything. Now, there's
That's
obviously
interesting.
pathologies that we have,
Yeah.
like gallstones or an impingement of the
Sure.
biliary duct and things like that. But what's
Things
important to
because
understand
yeah.
primarily is to keep the stomach and the hydrogen ions, which is what keeps the stomach at a low pH, to keep them active. And that's done, Danielle, through something called carbonic acid. So carbonic acid and water is derived from an enzyme called uh, anhydrase, which is carbonic anhydrase, which helps maintain that process
Mm.
of the potassium that exists and the chloride and that type of thing. I don't want to get too extravagant on the biochemistry,
Yeah.
but it's important to understand to keep this pump, this basically the potassium ion and the pumps, the hydrogen ions, and that basically maintain activity, correct mechanistic activity of the pH to keep it at 1 to 3 is vitally important to protect us. And that's what's really important. Now, understanding that pylori is a class 1 carcinogen, we see it associated with many cancers that exist in the stomach, adenocarcinomas.
Hmm.
That is one of the primary causes. What can elaborate this? Anytime we elevate the pH of the stomach, we're inviting a correct environment for something like a pathology such as H. pylori to incorporate itself in the stomach.
Hmm.
This can lead to further complications, not only ulcerations, but it could potentially begin to alter the cells, the epithelial cells within the stomach itself. And that's what I want to touch on. So the major use, and I know I'm going on a ramble here, I just want to continue. The
Yeah.
major use of proton pump inhibitors encourages the growth of pylori. Now, the reason proton pump inhibitors are given is because of something called gastric reflux or
Uh-huh.
GERD. People have heard of GERD.
Right.
And
Right.
that's when the cardiac sphincter, which encapsulates and keeps the contents of the stomach intact within the stomach, begins to become compromised, and regurgitation begins to occur. The regurgitation of the stomach contents can erode the mucosal lining within the esophagus.
Mm-hmm.
And in severe cases, it can be aspirated into the lungs, but that's
Right.
severe cases.
Right.
But what's important to understand is the use of proton pump inhibitors over a continual basis, chronic continual basis, can lead to the invitation of pylori. And then we have a whole different scenario
Absolutely.
on
And
our
I think
hands.
that, again, it's, we sound like a broken record here, but the proton pump inhibitors are treating a symptom and they're not treating the cause.
Correct.
And they're creating a whole other cast of side effects that are far more detrimental than the original problem.
Correct.
Yeah. So what can
As the
what can
as
someone do then?
okay, and we'll address that in just a second, and
Sure.
that's a good question. Another thing to be aware of is that by shutting down or changing this pH
Mm-hmm.
factor within the stomach, we begin to compromise the intrinsic factor.
Mm-hmm.
So the glycoprotein, the intrinsic factor, basically is responsible for B12 absorption. And the B12 absorption, as I mentioned before, can lead to megablastic anemia. It can lead to pernicious anemia and things like that.
Mm-hmm.
So it's not only the invitation of pylori, but it's also diminishing the potential of maintaining the intrinsic factor to where it needs to be. And many people have heard of a lot of things. I hear this all the time where they're lacking B12, you
Right.
know,
Right.
methylation and things like that. We talk about methylation, but we hear about a lot of things basically with regulating not only the pH, but regulating the intrinsic factor. Now, what's the intrinsic factor do? Is
Mm-hmm.
remember, it's a protein, and how it's important for maintaining the active absorption or utilization of B12. And that is what is really important to understand. So with intrinsic factor, the parietal cells, the intrinsic factor is secreted by the parietal cells. That's number one. And it's
Mm-hmm.
present in the gastric juice. But if we lower that, if we increase the pH, then what we're doing is we're compromising the ability of the intrinsic factor to do what it needs to do, if that makes
Okay.
sense.
It does. Because you're changing the
Now,
environment. So
now to answer your question, because remember, less acidic the less acidic environment in the small intestine is where the B12 is bound dramatically. And
mm-hmm.
that's what's by intrinsic factor, but not to compromise the intrinsic factor is vitally important.
Mm-hmm.
To answer your question previously, what compromises the cardiac sphincter? There's several things. Number one can be something like a pathology such as bacteria, like H. pylori itself. That's number one.
Okay.
Number two can be any type of food that traumatizes the area. And people say, well, food, how does food do it? Well, alcohol,
Mm-hmm.
being considered a food, traumatizes this sphincter.
That's
And
interesting.
the sphincter is responsible, once again, for encapsulating and maintaining the contents within the stomach so it doesn't regurgitate back into the esophagus.
Right. Because if you think about it, the stomach is so acidic, it going anywhere else is going to be harmful.
Correct. Another thing that can compromise it is something called a hiatal hernia. And that's where there's a pouching of the stomach through the diaphragm, through the orifice, basically.
Hiatal. So that's what a hiatal hernia is. Okay.
Exactly. The top of the stomach pouches through the diaphragm.
Interesting.
And basically, when this happens, it affects the way the sphincter functions.
Yeah.
Now, hiatal hernia can be induced by several things: trauma, obesity. Obesity is one of the primary causative factors of hiatal hernia, or even overweight conditions. Why? Because this compromises the anatomical structure. Now, the diaphragm is literally something that moves as we inhale
Mm-hmm.
and exhale. It separates the upper quadrant, the respiratory, the
Right.
lungs, that type of thing, from
Right.
the lower quadrant.
Correct. Right.
So what's important to understand here is that the hiatal hernia can happen in several different ways, and generally ill health, such as being overweight or obesity, can be one contributing factor. Other contributing factors can be obviously trauma, and inflammation, as I mentioned before, like alcohol, because alcohol dilates the stomach and inflames. Alcohol is a mild inflammatory,
Mm-hmm. Mm-hmm.
just so people know. And
Well,
that's,
yeah.
yeah, it is. It's a mild, that's why a lot of people with alcoholism have gastritis.
Mm-hmm.
I'm sure you know
Mm-hmm.
about that. And
Yeah.
gastritis is one of the major causes for not only a weak cardiac sphincter, but also hiatal hernias.
How would someone
Okay.
know if they had a hiatal hernia?
Basically, things get worse when they're laying in a supine position or laying face down. And
Okay.
laying face down basically can make a situation worse because the stomach, just like GERD, it generally gets worse as you're in a supine position. And that's
Interesting.
generally the one way that we can see
Okay.
symptoms of a hiatal hernia.
And then how does someone fix a hiatal hernia?
Hiatal hernias can be treated non-surgically. Basically, and what I do is with a lot of my patients, I ask them to get on an exercise ball in a supine position so their feet are touching the floor and their arms are touching the floor. So they're literally in a situation where it's convexity, or not a convex form, but basically they're laying back
Oh,
and
so they're on their back on the wall.
exactly. So
Okay.
the idea is to stretch and allow
Oh, to
that
pull. I see. That makes
protrusion.
sense. You pull
Exactly.
the stomach out of that gap.
The cardiac notch, exactly,
Yeah.
and the cardiac
Yeah.
notch is where the opening and the diaphragm is located.
And then would it
So
eventually just, is that something that always is open or it would
no,
eventually
no,
close?
it can it can redirect itself, so it doesn't have to protrude back. But that's
Uh-huh.
one therapy people might try. It doesn't mean it's going to work all the time, but it's a
For
therapy
sure.
that could be very effective.
And how long would you
But what
stay in that position? Sorry, just to finish
about
that thought.
15 minutes?
Okay.
About
And
15
every
minutes.
day or a couple times
Twice
a
a
day?
day.
Twice a
Uh-huh.
day. Okay.
But by taking and getting back to taking alcohol, the reason why it's so important to understand that alcohol is inflammatory because it's volatile. It's a flammable, volatile,
Yeah. Yeah.
colorless liquid
Yeah.
that basically it's inflammatory, and that's really important to understand. Is that
Oh, yeah.
this is the process that can actually create situations in the stomach to be worse. And
Mm-hmm.
anytime you take an isomer of an ether, an ether basically, when you take that component, I don't want to get too much into chemistry here, but you take that, it becomes reactive to tissue.
Mm-hmm.
So what happens in the basically this methyl group that forms, and it forms a dimethyl ether. What happens is that dimethyl ether irritates. It gets in and it literally inflames tissue. This is why ethanol or alcohol is so detrimental
Yeah.
to any type of tissue, particularly the alimentary tissue, not just the liver, as we all know.
Right. Like, I mean, and that's, yeah, for sure. But even just
So,
contact with that tissue. Yeah.
exactly. So,
Huh.
getting back to parietal cell, the reason I wanted this podcast, Danielle, is
Mm-hmm.
to emphasize how important the health of our stomach is,
Yeah.
number one, and how harmful long-term use of proton pump inhibitors medications can
Right.
be.
Right. 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 And, and I think it seems as if the big buzz is all about gut health, probiotics,
Mhm.
everything in the lower intestine, but you got to start in the stomach. You got to take care of that too. Like that's more
Exactly.
important. Otherwise, your chain is already broken before you've even,
Exactly.
yeah. So what do you
Exactly.
think? What do you think about probiotics? Just to
Probiotics
touch
are
on it.
great. Prebiotics, probiotics are great, but it
Okay.
has to be the right probiotic, meaning that a lot of probiotics, when the stomach's in the correct venue as far as pH, can't survive the stomach acid.
Yes, this is true. Right.
So one of the most effective one is Bacillus coagulans that I
Okay.
found out that can survive.
Okay. And then do you think that some of them that are, co I think the term is enteric coated or something like that, so they survive
Intercoated.
that? Yeah. So that's
Uh-huh.
a good thing to do. Okay.
Exactly.
Okay.
It is.
And then let's talk a little bit about, because I know in your clinic you have sometimes you have people do a test with betaine
Mhm.
to see what's going on in their system. I mean, sometimes that's like the first test you'll give them just to see, kind of is that, tell me what you're testing, and then let's talk about how you do the test.
So basically, betaine or trimethylglycine is a component that it's obviously three aminos,
Mm-hmm.
tri or amino
Yeah.
acid of glycine. And
Yeah.
what it does is it encourages the activity of the parietal cells.
Okay.
And it's basically something that is given, trimethylglycine is given to activate the parietal cells. And we use it frequently to treat conditions called hypochlorhydria. And the name literally is as it suggests, that there's low chlorhydria or low chloride activity in the stomach, which means low.
Low hydrochloric acid.
Exactly.
Yeah.
And that's why we give it. And
Okay.
what happens is most of the time, I'd say 85% of the time, most adults have hypochlorhydria
Mm-hmm.
because stress doesn't increase stomach acid, it decreases stomach acid.
Mm.
As we're in a fright flight scenario,
Mm-hmm.
our nerves and our scenario, our body is shutting down our alimentary tract, our digestive
Right.
tract, to conserve energy for our extremities because we're literally in that fright flight
Oh,
scenario.
yeah. Okay. That makes sense. That
So
makes
if we're
sense.
continuing through this, and that doesn't mean just like alarm status physically, it means also stress by reading your monthly bill, your mortgage bill,
Right.
your
Right.
bank statement.
Right.
This induces things that can be problematic.
Yeah.
So as problematic, meaning that it influences things like the stomach, and
Mm-hmm.
constant elaboration of this stress means that pH is going to gradually increase.
Mm-hmm.
As it increases, guess what's going to happen?
Mm-hmm.
You have the invitation of pathologies
Mm-hmm.
that can create other problems like ulceration. You've heard
Right.
about people going through gastric and duodenal ulcers.
Mm-hmm.
That's due not to a situation of hyperacidity, it's due to low acidity
To
that
low
invites
acidity.
pylori that aggravates the
Right.
mucosal lining of the
Right.
stomach and to
Right.
some degree the upper intestinal tract, the duodenum.
Right. And then so it can, ulcerations, and then I think you mentioned before, the slowing of B12 absorption.
Exactly, because the
And so,
intrinsic factor is
mhm,
lessened,
right.
and people talk about the intrinsic factor being there's it's popular right now that people are need B12 injections and things, which is not true. We find out that B12 could be administered sublingually. It's not as painful and it can be just as effective
Yeah.
as intermuscular injection administration of B12.
Interesting.
So
And
that's
are there people that can't absorb or are bad at absorbing B12 or methylating it? Is there like
well, there
you
are,
know what
but
I,
go
yeah.
ahead. Go ahead.
No, I just know of something called like there's a gene mutation or gene expression
Mhm.
that some people just don't, but maybe it's not B12.
No, no. What you're talking about is something called MTH. It's very popular,
Yes.
MTHFR.
Yeah.
And basically, but what that's doing is that's not looking, when you talk about that, it's not looking at what creates the process.
Hmm.
And low parietal cell activity
Okay.
is what creates it. The gene provides instructions for making the enzyme, but remember that gene prominently is influenced by correct parietal cell activity. It's all
Got
it's
it.
all interlinked.
So it's like it is what we're talking about is almost the precursor to that condition. If that
Exactly.
the health of your stomach is less than ideal,
Hmm.
then you can
Exactly.
develop those kind of conditions.
So
That's
people
interesting.
with people with this, it's become a high allow. It's kind of like it's like
It's
vitamin
like vitamin
D.
D.
It's
Yeah,
vitamin
it
D.
is.
People
It is.
just blow it
Everybody's got
all.
this condition. Yeah,
Yeah,
exactly.
and everyone has it because it's the popular fad. Now, it doesn't mean that it's not active, but one has to take care. And you know how I think, and the premise is get to the cause. Just by
Right, exactly.
administering
Exactly.
B12 all the time is not going to take you out of
No.
this downfall
No, you
of,
still have this condition.
the MTHFR. The people are
Right.
very popular with
And
that.
it's not right. And it's not as if, I mean, I think I don't see a whole lot of discussion about how to correct that. I see a lot of discussion about, oh, do you have it? And then, oh, it's just this condition that you're stuck with. But
Exactly.
it's
Exactly.
not that. It is
Exactly.
corrected.
No,
Yeah.
it has a cause.
Yeah. Well, that's interesting.
The
So,
gene mutation, how does the polymorphism, which means the several behaviors of the several mechanisms, how the gene functions and things like that,
mm-hmm.
is the common conditions that occur with this elaboration of saying that, you have this inborn error, so to
Right.
speak, or this
Right.
gene,
Right. That's
this
what they call it. Yeah, exactly.
exactly.
Yeah.
It has a cause. It
That's very
has a
interesting.
cause, and
Yep.
that's why I wanted to present
Yep.
the gastric. The gastric condition is the general of everything. It's the
Mm-hmm.
governor. It's
Yep.
what gets everything bump started as far as the alimentary tract. If you're
Mm-hmm.
not able to break substances down accordingly, because what does hydrochloric acid do? Its primary role is to break proteins down to a lesser
Right.
to a lesser degree carbohydrates. It really doesn't
Uh-huh.
touch fats. That's left up
Yeah.
to lipase and bile. But its primary focus is to start the whole process
Hmm.
that we're
Right.
referring to when it comes
Right.
to intrinsic factor, when it comes to the health of the stomach and the health of the upper GI, even the lower GI. I have been able to address a lot of conditions of IBS and Crohn's and celiac just by addressing the pH of the stomach.
That's very interesting. So IBS, Crohn's, and ulcerative colitis too, do you think?
Exactly. Ulcerative colitis and Crohn's and celiac, sprue, all of those can be addressed many cases if you address, or they can be helped greatly if you address the
Right.
alimentary tract, the stomach. Take care of the stomach.
So interesting.
And the intrinsic factor.
What
That
other
doesn't have to
things?
be
Yeah.
a gene mutation.
Right.
MTHFR does not have to be a gene mutation.
Uh-huh.
I'll remember, the intrinsic factor is secreted by parietal cells.
Right. Are there other things that affect the intrinsic factor? Are there other
Uh, well, yeah, malnutrition.
malnutrition? Okay.
Yeah, malnutrition, because if you're not getting correct amounts of methylcobalamin, there's methylcobalamin and cytocobalamin and all these different forms of B12, but
Yeah.
methylcobalamin is the one we more frequently use or are
Like,
aware of.
yeah.
And all it is B12 and the importance of how B12 works with the red blood cell. And that's why we need it. That's why it's so important. That's why you hear about
Hmm.
megablastic anemia and macrocytic anemia. I could go on and on. All of the pernicious anemia. So malnutrition can be another cause for losing the ability to supply the correct amount of B12.
Hmm.
B12 is
Wow.
important.
It is. No, it definitely is. And I think I'm just thinking back because when people talk about anemia, it's always like, oh, take more iron,
Yeah,
right?
no, and iron's toxic.
Right.
That's
So
one of the
that's
worst things. Oh God, that's one of the worst things you could do.
right. Like what?
Is
I mean, that's
you're
like
taking
Yeah.
yeah, you're taking in iron, and I encourage people to look it up. Iron is toxic.
Yeah.
It is a
So are you
metal.
suggesting
It's an
people should
element.
never
It's
take
toxic.
iron?
Yes, that's what I'm suggesting.
Okay.
People should never take iron. They should take B12.
That's so interesting, Kevin. Never take iron, take B12.
That's my
Start there.
suggestion. Now,
Yeah.
that's from what I know. That's sitting from my chair, my experience, 37 years. Iron is something that is mishandled, like vitamin D. It's
Right.
mishandled. People don't understand. These are Gesundheit.
Yeah.
These are
Thank you.
toxic. These
Yeah.
are very toxic. It's not that
Huh.
they're safe. People think that they're safe because they're considered, a vitamin. Iron's not a vitamin, but like vitamin D, they think it's safe. No, it can
Right.
create problems. Just like iron. Iron is an element that can be toxic. It can accumulate in the tissues rapidly in the organs.
Yeah. So let's break this down just for a second. So anemia is you have low iron levels, but you would elevate those iron levels by taking B12, not by taking iron.
Correct. So
And it
there's
would
three.
be and your body would know how to absorb it from food and stop when it has what it
Correct.
needs. Okay.
Correct. So there's
Yeah.
three primary ways of checking iron. There's something called ferritin, which is iron bound to a protein.
Yeah.
There's iron binding capacity, which gives us the ability to know how iron is binding
Hmm.
to the cell.
Yeah.
And then there's pure iron. There's just serum iron. So we test
Serum
those
iron.
three things. So
Interesting.
anytime we see a change or an alteration in iron binding capacity, anytime we see a change in ferritin, that gives us an idea of what's happening, primarily due to the lack of methylation and intrinsic factor.
Right. And so the first place you should look is the stomach.
That's correct.
And then you say, okay, I'll stop drinking alcohol
Or stop or
and
revisit
stop the
proton
proton.
pump
Yep.
inhibitors and
So
look at
interesting.
eradicating pylori, because generally pylori can be a
Mm.
causative factor, not all the time.
Oh.
Look at addressing the cardiac sphincter
Uh-huh.
and strengthening that, so you don't have to deal with taking intrinsic or taking proton pump inhibitors.
Uh-huh.
Another thing is
And when you say
there's something called deglycerinated acid,
yeah.
and it's short. We use it rhizinate, and they're chewable. And all it is licorice that has been basically treated so it doesn't elevate blood pressure, because licorice
Right.
has a tendency in its pure form to elevate blood pressure in
Yes.
certain situations because of the
Right.
effect on aldosterone. But it's important to understand that you can take something like this and alleviate if you have gastric reflux or GERD without looking at a proton pump inhibitor, because once again, you're shutting down something that is viably important. The reason you have parietal cells is not a mistake. You have
Exactly.
evolved to have parietal cells. You've evolved to break foods down. And once again, we're getting into this situation to where, for some reason, humans, and I'm fascinated with humans, their mindset about why they think that something you've evolved to have intrinsically should be shut down.
Right. Right. It
I
makes
just
no sense. It's pretty
Yeah, and
mind
I'm
blowing.
not the smartest guy in the world, and I'm dumbfounded by this. It's Danielle. The reason for these podcasts are to try to make it as simple as possible for people to exercise common sense. That's all I want to do, because our viewers are probably smarter, if not smarter, than I am, and all I want to do is invite the carpet to say, listen, let us look at common sense. Let's not override it.
Right. Right. Well, and let's get down to the core of the most basic science of the human physiology. I mean, it's not
Exactly.
It's I don't want to say it's not rocket science, but it also is it can be complicated, but it's also simple at the same time.
Right.
you know?
And obviously science is an ever correcting aperture.
Mm-hmm.
We always learn. I always learn. And
Yeah,
that's the beauty of science. It's not a
absolutely.
fixed scenario.
No.
And that's the beauty about this, is always learning new processes.
Mm-hmm.
What we don't want to do is we don't want to go backwards.
No. No. And we don't want to create
And
more problems. Like, let's stop creating problems.
and I want to revisit, as I have before, have we seen a diminishment in primary pathologies today? Or are we seeing an
Right.
increase?
Well, and that's, I mean, I think that's a key factor.
Yeah, and I don't.
If all of everyone's health problems were gone, then great, we're on the right track. But
Uh-huh.
they continue to escalate.
And
So,
then a question arises, well, Kevin, the populace is continuing to go up. No, we're talking about a ratio
yes,
of
right,
pathologies
exactly.
going up. It has nothing to do with the
No,
populations, how
no,
many
yeah,
people are
exactly,
beginning to suffer from these
exactly,
things. And
exactly.
my platform is to, let's exercise common sense. Let's look at causative factors and
Mm-hmm.
let's move forward. I am suggesting to evaluate. Medicine is not a bad thing. I
No,
come across, people think that I come across like, oh, you don't use any drugs. No, that's not.
no,
Drugs
that's
can
not the point.
save people's lives.
Absolutely, absolutely.
Use the right tool for the right
Yep,
situation. And
yep.
that's what I keep elaborating on.
Stop using a sledgehammer if you don't need it.
Exactly. Don't use a
Yep.
chainsaw to cut a cube of butter.
No,
You don't
for
need it.
sure, for sure,
And
for sure.
that's the point. And a lot of physicians are doing the best they can. I give them
Mm-hmm.
accolades. I do. I give them, I applaud. But in cases like this, we need to delve a little deeper into causative factors, and that's
Right,
another reason why I wanted
right, right.
to begin these podcasts, is to inform
Absolutely.
people about this.
Right, right. Let's look at the causative factors. Let's just take it one step beyond, you know,
Exactly.
again, the symptom. Let's take it a step beyond the symptom for sure.
Exactly.
Yeah.
So
Right.
to
Well, that's
to as a summary,
sure.
if someone is on long-term proton pump inhibitors,
Yeah.
reconsideration that stress creates ulcers by
Yep.
increasing acidity, which it
Mm-hmm.
doesn't.
Right.
Stress actually elevates the pH in the stomach.
Mm-hmm.
Reconsideration about how important the health of the stomach is for breaking foods down so proper absorption can occur.
Right.
And that's
All of those
important.
things. Yeah.
Mm-hmm.
So I just have one quick question because I know we're running short on time here, but for as people age, do you think does it have to be a given that your digestion just starts to suffer as people get older?
Well, the question about aging means an accumulation of processes that have occurred over those years.
Yeah.
If you've aged and you've been healthy and you've taken care of yourself, you generally don't have to worry about it. But the
Right.
aging process is an accumulation
Yeah.
of other behaviors and other patterns. And those behaviors and patterns can elaborate more problems with the
Right.
gastric health.
As you accumulate years on your timeline.
Sure.
Yeah.
That's
Yeah.
why
Okay.
generally adenomas, carcinoadenomas or adenomas
Right.
of the stomach
Right.
basically occur as people get older, is because of the accumulation
Right.
of
Right.
things that have
Of
been
things going on. Yeah.
exactly.
So you can age healthy. It's possible.
Yeah, I mean, I'm not
You can be up in numbers and still be healthy for sure.
Yeah,
You're a great example of that.
I'm 67 years old. I never thought, you know what I'm saying? I mean, compared, and I attribute that to just taking care of my food, my diet, and
Mm-hmm.
I've been very
Mm-hmm.
fortunate to have been taught by many practitioners in the past and in the
Right.
future. I mean, look at it in the future time. So
Right.
I just want to convey and be able to share what I've been able to do with my health, and share that with other people and say it's
And with
not
your
out of
patients,
reach.
you know,
Yeah.
I think, you know, you have patients in your clinic that you've been able to help as well.
Mm-hmm.
So
It's not out of reach of anyone.
No.
And many
No.
people throw their hands up and say, well, it's too late. I'm
It's
50
not too
years
late.
old. No, it's not too late at all.
Not at all. Not at all. Well, thank you very much for this. This has been very interesting.
Well,
And,
thank you for your time, Daniel.
Absolutely. We'll have the details down below in the notes, and subscribe and like today. All right,
Thank
Kevin.
you so much.
You're
Take
welcome.
care.
Have a good
Bye.
afternoon.
You too. Bye-bye.